Good day, I'm Jennifer. Now what I'm going to do is the neurological assessment, which is focusing on Glasgow Coma Scale. So Glasgow Coma Scale is used to describe the extent of impaired consciousness in all types of acute medical and trauma patients. So the scale assesses the patients in three aspect of responsiveness, which is the eye-opening, motor, and verbal responsiveness. So an initial score of less than 5 is associated with an 80% of being in a lasting vegetative state or death. But an initial score of greater than 11 is associated with 90% chance of recovery. So, in severe po, ang Glasgow Coma Scale of 8 or less is severe. In moderate naman po, if 9 to 12 is moderate, and then mild is 13 to 15. So, before doing the procedure, make sure that you check the doctor's order, you verify the doctor's order, check din po natin yung medical record ng ating patient to check if tama po ba yung ating patient, and then yung order ng doktor. And then after verifying the doctor's order and the patient's medical record, so next is prepare po natin yung ating mga equipments. But make sure po na tayo nag-wash your hands and then sanitize. Then after that, wear your PPEs, and then this is your material. So make sure that before going to the patient's room, make sure that you completed all the materials. So the materials that we're going to use in this procedure are the gloves. Make sure it is sterile, and then the pen light, and also your ball pen. So after completing your materials, and then when you are prepared, so we can now go to the patient's room. Good day, sir. I'm Fernelyn, your nurse for today. So, what's your name po, sir?
Jake Mercado,
And your birthday po?
November 8 po.
Okay. So, when you enter your patient's room, make sure that you introduce yourself to the patient, and make sure to identify your patient using two identifiers. So, natanong ko na yung name and birthday niya. So, check po natin sa wristband kung tama ba yung kanyang sinabi. If tama po dun sa, kung tugma po sa sinabi niya, yung pangalan niya sa wristband, so, we have the right client. So, next is, explain the procedure to the patient. So, sir, I'm here po para po mag-conduct po ng neurological assessment, which is focusing on Glasgow Coma Scale. So, don't worry po, sir. Ito po is order ng doktor. So, ito po is safe and mas makakabuti po sa inyo. And, mag-check lang naman po ako sa inyo, and kailangan ko lang po ng cooperation nyo. Okay lang po, sir? Okay. So, let's start the procedure. So, make sure that you wear your gloves and your PPE. Okay, so let's start. Now, we can now start in the eye response. So, we can check the opening of the eye of the patient. So, I noticed that my patient is spontaneously opening his eye, so I can give him the score of 4. But if the patient don't open his eyes spontaneously, so I will start to talk to my client. So if the patient respond to the sounds that I give, so I can give him the score of 3. But if the patient didn't respond to the sound, so you can use pen light. Then check po natin yung eyes ng ating patient. Okay, so and let's start squeezing the luminal area of the patient. So i-check natin yung luminal area of the patient's fingernail. So while doing this, so ito po yung mas effective po ng So, check po natin yung luminal area. So, while doing this, check po natin yung patient's grimace. So, pagka po ang patient is nakitaan natin ng pain sa kanyang muka, sa kanyang grimace, so we can give the score of 2. So next is I will be asking the patient whether if there's a pain condition, and I have noticed that wala po siyang response, so I can just give him the score of 1. So ask po natin if pag tinanong natin siya kung masakit ba and then wala siyang response, so you can just give the patient the score of 1. So next is the verbal response. So in this we have the lowest score of 1 and the highest score of 5. So in doing this, let me first ask the patient what is his name, date, and place. So, hello po sir, what's your name po?
Kate Mercado.
Alam niyo po ba kung anong date ngayon?
June 3.
And nasan po kayo ngayon?
Hospital.
Okay, so if the patient answered correctly, so we can give him the score of 5. But if the patient is confused, so sir, ano pong pangalan niyo po?
Justin Mercado.
Ano pong date ngayon?
June 6.
Nasaan po kayo ngayon?
Bahay.
Okay, so if the patient is confused in his surroundings and his name, so we can just give him the score of 4. So it means that he is oriented but at the same time is confused. If the patient answered in inappropriate words, so to our questions, we can give him the score of 3. For example, so sir, what's your name po? The day-to-day po, sir. So, nasan po kayo, sir, ngayon? So, the patient answered but in inappropriate words. So, we can't understand what the patient is saying. So, we can just give him the score of 3. So, next is but if the patient didn't give but there's no conversational exchange, but the patient came to give a comprehensible sounds like moaning but no sounds, so we can just give him 2. But if there's no response at all and no verbal response, we can just give the patient the score of 1. Next is the motor response. So the lowest score is 1 and the highest score that we can give is 6. So first is, sir, can you please stick out your thumb? Okay. And next is, sir, can you please hold my hand? Pahatak nga po. Okay. Thumbs up po. So if the patient obeyed your command, so we can you can give him the score of 6, which is the best response. So next is but if the patient didn't respond to command but localized pain, you can give him the score of 5. So I will going to pinch the patient's shoulder. So we can see that the patient forcefully move his hand to his painful shoulder. So, but if the patient didn't obey the command, but localized pain, so but didn't localize pain, but it responds, you can give 4. But if the patient responds with the abnormal flexion, so we can just give him the score of 3, like this. So his hands is like this. So yung hands niya is naka-clench para po siyang pa-letter C, and then yung check din po natin yung paa niya na naka flexion response. Okay? So but if the patient didn't respond in a abnormal flexion, so we can just give him the patient with a score of 2. So we can give the patient with a score of 2 if his hands is like this. So it's like this, and then his foot is like this. Okay, but if we didn't receive any response at all, we can just give the score of 1. So now we just finish assessing the eye opening, the motor response, and also the verbal response. So after assessing the patient, we can now position the patient in a comfortable position. So adjust po natin yung kanyang pillows or yung kanyang bed. And then ask po natin if patient ba is comfortable. So sir, are you comfortable with your position? Yes? Okay. So sir, thank you for your cooperation. Just press the button right there if you need anything. So pwede niyo po akong tawagan po sa nurse station if may kailangan po kayong assistance. Okay po? So after that, make sure that you document all your findings in a CS sheet or the Glasgow Coma sheet. Okay, so don't forget to document all the findings, and then after that, you can now collect all your materials that you need, that you used in this procedure, and then you can now remove your PPEs and then your gloves, and then you can now wash your hands and sanitize your hands. So that's the end of my video. Thank you for watching.